1.5 millimeters today. Veneers can have 1 millimeter reduction all the way up to 2 millimeters, but I thought that we would just do something in between at 1.5 millimeters. And you can use the thickness of the burr as a guide, but you can also use other measurement instruments. We can use the RGS-4 to verify 1.5 millimeters of depth cut in this particular case as well. So let's go ahead and let's remove the portion between the teeth. I have this in fast mode so that you can get the point if we're just reducing this straight across with a slight inclination towards the lingual. Using the burr tip just to remove those little peaks at either end is pretty easy to do, and you can use the burr also obliquely so that you can remove any scratches or irregularities on that incisal edge. This trick of using burrs in this particular manner is very, very effective, and we're just removing those little peaks on either end. I own a laboratory, and one of the things that we notice with some of our doctors is that the lingual margin definition is a little bit irregular on veneer preparations, and I think that if you can make that lingual definition very clean and crisp, it allows the technician a much easier time making a nice veneer. Furthermore, when the veneer is seated, you'll be able to see that it's seating properly. So I like to spend plenty of time making sure that lingual is really straight. So now we've reduced 1.5 millimeters and we're ready to go ahead and place our facial depth cuts. So let's use the LVS1, which is 0.5 millimeters, and we're going to use it in the same way we did in the previous video. We're going to rotate it so that we can get the middle third, incisal third, and gingival third areas prepared, but we're not going to take this depth cutting burr too far close to the gingival area because we know that that area is very thin in enamel, and we're going to want to use a more conservative approach in that particular area by using the tip of that LVS4, which is very, very small at the end. It only allows us to create a 0.3 millimeter marginal depth. So we're just using the burr across the facial as we've done in the previous video to get the depth cut started, and you just move it steadily from mesial to distal. Pretty easy to do, but remember that you need to rotate it so that you follow the facial contour. That little portion between the diamond cylinders is going to stop this burr from going too deep, and you can see the little scuff mark there from the shank of the burr rubbing up against the plastic tooth, indicating that we have in fact reached the full 0.5 millimeters of depth. Remember to rotate it so that this burr is getting the adequate depth lanes of that facial surface. We're now going to utilize the LVS3016, which is the thicker of the two veneer margin type prepping burrs, and this one is just very efficient at removing these little enamel bridges between the depth cuts, and it's pretty quick. But we're not going to take this tip and run it down along the gingival because it would be a little bit on the aggressive side. So let's just watch as we prepare that gingival area with the LVS4, which is 0.6 millimeters, and it's going to give us that 0.3 millimeter marginal depth that we're looking for to be ultra conservative. Remember to tip the burr 90 degrees to the facial in order to develop a shoulder that runs up to the incisal edge. After roughing out the preparation, let's go ahead and place the preparation guide back on the patient, and let's evaluate how close we are to achieving this 0.5 to 0.7 millimeters of clearance that we need to have on a veneer. And I think that if we were to measure this incisal area, that's an RGS2, that's 0.75 millimeters. You can see that we're right about where we want to be. And that would be an optimal amount of reduction for standard veneer preparation. The middle third, we can also use the RGS2 to measure that. See that yes, that is maybe just slightly less, which is good. And then we can look at the gingival and see that it's even less than the previous section we checked. The RGS1 is 0.4 millimeters, so we're probably about 0.55, 0.6 millimeters there. We've continued the preparation a little bit to make the continuity between these vertically oriented shoulders and the incisal edge connected. And they connect in these little interesting little channels that sort of wrap around the corner like this. In this particular area on the distal, you can see that the location of the margin is far too much facial, so we're going to extend that more towards the lingual on that side. So that's what we're doing now. We're just making a correction of that distal margin location to bring it closer to the contact area. In some cases, you're going to want to bring that margin location right now to get the initial depth cut of 0.3 millimeters across the facial. Now we would go deeper if we needed to for shade changing purposes, or if there were some other structural reasons for going deeper, but in this case we're going to go with an ultra conservative veneer preparation. You notice how I hold this in the middle third. Now if I want to get the depth cut at the gingival third, I have to tip the burr so that it's parallel to that gingival third. And you can see how the middle third isn't really cutting, it's just the gingival third that's cutting. And we'll get that 0.3 millimeters that we require there. And then we can tip the burr back the other way towards paralleling the incisal third of the facial to get the incisal depth cut. So the burr can be used really easily and very quickly to get the proper reduction that we're looking for. We're now going to move on to the LVS 4014. This is a terrific burr that has very good dimensions for veneer design. It's a coarse burr, which means it's 125 micron diamond grit thickness for the shank, but the tip is only 30 microns in grit and much more conservative. And the tip diameter is 0.6. So half of that tip diameter is going to give us a 0.3 millimeter gingival margin depth. So I'm removing right now the middle portion of the preparation between the incisal and middle portion, this little raised area, very carefully, and then I'm going to reorient the burr so that I remove the portion that's between the middle third and the gingival third. So I have to always think about keeping my burr parallel to the facial surface in order to conserve the removal of enamel. Remember, we're not dealing with a lot of enamel thickness, and I think that frequently we can get so focused on other things while we're prepping that we're not keeping in mind that the enamel thickness in most cases is very, very little. And you can see that we're going to keep this particular preparation super gingival simply because I want not to damage the gingiva of the typodont, but you could keep these equigingival. You could even make the preparation slightly subgingival, maybe as much as 0.5 millimeter if you needed to. In those cases, you'd want to use retraction cord to protect your gingiva while you're prepping. I like to prep these usually with rubber dam in place so that we have excellent protection of the tissue, but sometimes the rubber dam hides some important features of the tissue that would give us information about shaping and finessing the preparation. So oftentimes it's a good idea to remove the rubber dam when you're doing the fine-tuning of your preparation. And this works pretty quickly. It's no different than any crown prep except for a major difference, and that is light touch, very, very careful. Don't over-reduce. It's extremely easy to over-reduce. Remember, half the tip diameter on this burr is 0.3, and this gives us a very optimal depth at that gingival. we're going to go ahead and place the stent on here and see that we have decent reduction in that middle third by utilizing this preparation guide over here on the mesial side. But on the distal side, you can see that it's definitely under reduced. I would not have known that simply by looking at the facial. If we look at the gingival third, it looks to be a little bit more uniform. So we're pretty happy with that particular area. But putting this back together again, we can see that that distal portion might need to be reduced a little bit more in the middle third. The incisal third is much closer to what we would want. If we want to reduce a little bit more incisally to give a little bit more characterization of the ceramic, that's not a bad idea, but I'm going to give you the most conservative possible design for a facial prep veneer. Obviously, a no prep veneer is the ultimate conservative preparation, is no preparation at all.